Hey guys, welcome to Mystery Diagnosis. The reason my eyes look red and swollen is because my tear ducts are blocked.
I have these scaly, dark patches of skin on my cheeks. When I put my foundation on, you could see a dark area where that area of skin was drier than the rest.
One of the first things that actually attracted me to Amanda was her beautiful hair, and it was very dry and brittle. She just started really complaining about how terrible her knees were hurting. That just kind of came out of the blue.
Amanda tries a series of home remedies hoping to alleviate the excruciating pain, but none of them seem to work.
On her neck felt enlarged. The right side was a little bit more prominent compared to her left side on her thyroid. And then when we check on her muscles, there was a decrease in terms of the muscle relaxation time.
Hashimoto's disease.
Hashimoto's disease is an autoimmune disorder in which your immune system produces antibodies that attack your thyroid gland, a butterfly-shaped gland located at the base of your neck. In a healthy individual, this gland produces hormones that help regulate many of the body's activities, from muscle function to metabolism. But in patients like Amanda, the attacking antibodies gradually destroy the thyroid gland, making it almost impossible to produce the hormones the body needs.
Right.
On a medication that mimics the hormones produced by the thyroid gland to start treating her symptoms.
Luckily, this one is easy to treat.
Amanda's doing a lot better. Her hair is back to normal. Her skin is good. She still has some pain in her leg.
Sorry for the short video. I still hope you enjoyed. I just wanted to continue doing my job, meaning YouTube, and post a video even though it's short. So even though I'm not really feeling well because of the blocked tear ducts, I still made a video, which is actually pretty good. So no, I'm not letting blocked tear ducts stop me from doing my job or having dates with Call Me Kevin. Just letting you know, my tear ducts did unclog. So I'm going to the doctor tomorrow if the swelling isn't down. So the videos are not cancelled for me going to the doctor, and also Call Me Kevin dates are not cancelled either.
But 1 week later, this is what Samantha looked like, and no one knew why.
I know what it is.
Nutrition called me and said, "We've noticed that Sam has had high blood pressure, which is unheard of nearly in newborns." And then I started noticing when I went into the NICU, her had gotten a lot bigger. She was real jowly, like a chipmunk. The nurses kept saying, "Oh, look at those chubby cheeks. I just love those cheeks. I want to grab those cheeks." And I'm thinking, that is not normal. There's something wrong with these cheeks.
That's why I dislike
She got to the point where she...
The one that I thought made the most sense at the time was that she was simply born too early, and by the time she actually reaches her due date, her original due date, that some of this would resolve.
I could agree with
We weren't
that
getting
if
any answers
I
as to why
hadn't seen
our
this
baby was so
condition
sick.
before.
It was a terrible feeling. It really was. It was a terrible feeling.
But within a few weeks, Sam started to get better. Her cheeks lost their puffiness, and Jackie and Bill
To be
tried
clear,
weaning her
what I
off the blood
meant
pressure
is I've seen this
medications,
in
which
medical
they
shows.
thought
I haven't
might
seen
have
it in
been
real
causing
life.
some of the listlessness.
And lo and behold, her blood pressure numbers didn't go up at all. In fact, they continued to go down until she reached a normal level.
For the next 20 months, Samantha seemed like a perfectly healthy child. Then, practically overnight, she started to change.
It started with this ferocious appetite. She would ask me for, she didn't talk very much then, but she would ask me for num num, num num, num num, and this was a child who never really ate.
She would just shovel food into her mouth, and then she would complain that she was hungry again.
It's about then that I noticed the swelling coming back in the face and the redness, and then a little acne on her forehead, and her eyebrows started growing together.
She gained over 10 pounds in maybe a little over a week, and wasn't our little girl anymore.
And looked at her pictures and looked at her.
She was a little overweight, but she was not morbidly obese.
It's Cushing Syndrome.
Cushing syndrome is a potentially deadly malfunctioning of the adrenal glands. These glands make hormones that are vital for development and managing stress. But Cushing's causes them to produce too much of the hormone cortisol, leading to weight gain, excessive hair growth, hypertension, bone loss, and muscle damage. His determination paid off. The doctors found that Samantha's adrenal glands were covered with microscopic nodules that were causing them to overproduce cortisol. The only hope for a cure was to remove the glands.
Thank you for subscribing.
A couple of days, and she was up and talking and reading and watching television. That was such a joyful moment for us because it was like, okay, you know, she's really going to be fine.
Sam's like a whole new girl. It's been almost a year and a half since surgery, and it's like we got a new kid a year and a half ago.
I'm glad.
A single operation has transformed Samantha's life.
I recommend you see a doctor if you have blocked tear ducts, but if you are like me and want to try how methods you use eye drops or compresses, like have a hot water bottle or whatever they are, and then have a cloth around it, and then have another cloth, and then apply that to the tear duct, and then go to the doctor. For me, the eye drops don't work as well as the hot compresses, but I eventually will go to the doctor. I changed my thumbnail on the autoimmune dermatitis video. I'm hoping to get more than one view, otherwise I'm trashing it. I'll see you in the next video.